Welcome back to the American College of Surgeons Bulletin Brief from the Front Lines. Today, we're going to be speaking with two of our directors from the American College of Surgeons, both of whom are return guests to the From the Front Line series. Dr. Patricia Turner, the Director of Membership Services, and Mr. Christian Chaljan, who's the Director of Health Advocacy and Policy. Welcome both.
Thank you.
Thank you.
Great to have you both here. And the reason why we're all three together today is to talk about the upcoming Leadership and Advocacy Summit, which normally would be held in person in Washington, D.C., and would usually be starting out on Saturday and then continuing on till about Tuesday or so. So perhaps we could start out with Dr. Turner and tell us a little bit about the history of the Leadership Summit.
It's been through a couple of iterations. In the beginning, as many of you know, the ACS had a spring meeting. And when the spring meeting went away, there had been variously arrangements to have an advocacy summit and then a leadership summit. And for a time, we did a joint advocacy meeting with other surgical specialties. But what's happened the last 8 or 9 years has been a reimagining of the entire thing. Still very much a joint effort between the Division of Member Services and the Division of Advocacy and Health Policy. We're bringing surgeons, leaders of all stripes together for actionable leadership topics. So whether you're a regent or a governor or a chapter president or a leader in your practice, you have a role here in the Leadership Summit. And so there's lots of talks that talk about different facets of leadership. And then that seamlessly weaves into the advocacy and health policy piece with the Hill visits. So I know Christian's going to talk about some of the Hill visit elements, but it really is important for our leaders to be engaged with advocacy.
100%. And as somebody who is on the Board of Regents and previously Board of Governors, I can attest to the fact that it is critically important to engage in those conversations. So, Christian, perhaps you could elaborate on what's happened during some of the prior in-person summits.
Sure. No, and I appreciate the invitation to be here today. We have a lot going on with advocacy right now. So many different initiatives. So much of what happens to surgeons are defined by what policymakers are doing in Washington, whether it's the Medicare physician payment issue, which we know not just affects Medicare, but also affects all the private payers as well who pay based off of Medicare, or it's the trauma issues, cancer funding, health equity issues. So many issues right now are being debated in Washington, D.C., and every year, as we bring these issues forward as part of the Advocacy Summit, it gives an opportunity for surgeons to bring their voices directly to the legislators. And I used to, before I worked for the American College of Surgeons, I worked on Capitol Hill. I've been in these congressional offices. I know what it means in these offices when doctors come in, surgeons come in as constituents. They live in the district, they work in the district. They're telling the congressman what the support is that they need. The beauty of the Advocacy Summit that we've had that's grown so much over the years is the fact that we're bringing residents with senior surgeons all in the same room together. And while I know that there's a pecking order of surgery in terms of how surgery works, there's no pecking order when it comes to advocacy. The resident's view is as important as the senior surgeon's views, and they all come together to bring that message about surgical patients and what's important to surgical patients. And it really is one of the most powerful tools that we have. And it's really grown over the years. And we're really excited about this year's Advocacy Summit.
Excellent. You mentioned growth, and perhaps I'll ask you first and then Dr. Turner. What do you expect in terms of attendance relative to an in-person meeting?
I expect the numbers to go up substantially. We've already started seeing the registration numbers already going up. We started bringing surgeons to DC more than 20 years ago. And we used to do them as state chapters and bring them in small groups. And we decided that it was much better to bring everybody together and do it as one big powerful force. I'm already seeing registration numbers that are far superior, far larger than we've seen in advocacy summits before in the past. We've got a lot of young people who are registered, which is fantastic. I've got some of the most senior surgeons, chairs of surgery. We've got them all coming in. And the beauty of this year's Advocacy Summit and Leadership Summit is the fact that it's virtual. You don't have to fly and do the travel and do the hotels and all that kind of stuff. You can do everything right from your office, right from your living. So that, I think, is one more indication of how it's easy it is to do this and engage in the process. And the numbers are showing that already in the registration numbers, and we're excited.
Yeah, it's interesting because last year we saw tremendous growth in the Quality and Safety Conference, subsequently in the Annual Clinical Congress, but yet we hear that ease and facilitation of sitting in one's office or at home and participating in these things is perhaps being eclipsed by people just having fatigue from being in front of screens and chatting or watching with Zoom fatigue. So I'm curious also from the Leadership Summit point of view, Dr. Turner, what's our expectation?
Well, as Christian said, we have noticed definitely an uptick in registration. The last year that we had the Leadership and Advocacy Summit in person was 2019, and we had well over 500 attendees at the leadership component. We're already over 1,000, and the meeting is still a couple weeks away, so we expect those numbers to continue to go up. It's a virtual platform, so to your point, we are very conscious about Zoom fatigue, but we also realize that there's a balance. There's something to be said for not having to get on a plane and fly across the country and stay in a hotel and be away from our practices, our families, and so on. That said, we are trying very much to maintain the elements of this meeting that have been so successful in the past. There's some things that we can't do. We used to have a social event on this Saturday evening, which was really wonderful because everyone had a chance to mix and mingle and have that sort of camaraderie and those sorts of discussions. And obviously it's hard to reinvent that online. That said, the leadership talks are going to be really engaging, and the benefit of having it be online is that you can come and watch it at your leisure. So even if you're busy, for example, on that Saturday when the meeting is happening, you can watch it that evening or the next day or whenever. And so we learned definitely from Clinical Congress that our members want to be able to access education and these talks when they have time and not necessarily on the footprint of the meeting.
Dr. Wexler, let me just add in on that for a second, because I want to give a lot of credit to Dr. Turner and her work on international parts of our membership. And we have seen the numbers for the leadership conference from the international surgical community go sky high. And a lot of that credit goes to Dr. Turner for her work over the years in developing the relationships with the international surgeons and making sure that invitation got out. And that's another great opportunity for the Leadership Summit to be able to bring the international surgeons in as part of this, because the travel obviously makes it much more challenging in a normal year, but this is another great opportunity.
Yeah, that's an excellent point. I echo your sentiments that she's done a spectacular job with the Leadership Summit and the Annual Clinical Congress, as well as with international, attested to not only by the attendance at the meetings, but by the number of initiates each year and the composition, the distribution of those initiates, particularly being international. And that mixing and mingling is important, which I guess gets to the next point, because particularly for leadership, I mean, advocacy is separate, but for leadership, Patricia, some of the things that I enjoyed are the breakout sessions, for example, the state chapter breakout sessions. I enjoyed the fact that you'd always find a speaker who didn't like to stand behind the podium, but came out into the audience and would actually ask us questions. So how do you plan to reproduce some of those elements?
Well, our goal is to make it as interactive as possible. We certainly will have great talks. We're covering, topics that are actionable and relevant, implementing impactful ideas in healthcare delivery, cultivating high performance teams, improving patient outcomes, authentic leadership, empowering early career surgeons. So again, we're trying to tackle multiple topics, so there is really something for everyone. Obviously, it won't be quite the same as turning to your neighbor and having those conversations that we've had in years past. But I do think that we will also hear some of the chapter success stories that people have come to expect. Some of the things that come out every year is that we hear from certain chapters that have put things in place, often things that they thought of at the previous year's Leadership Summit. And they've come together as a group, across the state, thinking about what would impact patient care locally, what helps those surgeons, boots on the ground in that state, come together and care for their patients more effectively. And then they share that And then other chapters can often implement those same things. So we will have some of those familiar elements. The state breakout sessions won't happen because it's just a little bit difficult to organize. But when they're coming together for the advocacy component that Christian's doing, that will be an opportunity for individuals to see others from their state or from their district as they participate in the Hill visits. The other thing that I would point out is that Christian and I, for the last several years, have really wanted to support residents to attend this meeting. So we've offered scholarships to bring residents. This is a year where quite literally anyone can participate. Like every single resident in the American College of Surgeons could participate if they wanted to. There is no registration fee. There's no charge if you're a member. And we understand how difficult it is for residents to get time away to participate in something like this. But as Christian said, if you're talking to a legislative aide or a senator or a congressperson, everyone in that district has a vote and everyone's vote counts. So residents are powerful in this engagement.
Yeah, excellent points. And on some prior interviews, I've spoken with some of the younger folks from RAS and YFA about advocacy and healthcare policy, and they are tremendously engaged, and they become some wonderful ambassadors for us, not only in RAS and YFA, but in their own hospitals, and get a lot of their mentors engaged. And they talk about which is wonderful. So I guess, Christian, towards that end, do you have any idea sort of the anticipated distribution of people, or residents versus senior fellows?
I expect the numbers to be high on both, in terms of probably higher than they have been in previous years in all categories, but we're seeing a lot of residents joining, which is fantastic. The Advocacy Summit portion of the meeting is really over 2 days. The first day on Sunday is about the issues of training. How do we learn about the issues? How do we get accustomed to what the Hill looks like? What's some of the background? We're going to be talking about Medicare issues. We're going to be talking about quality of surgical care, how that gets measured, what the government is and isn't doing appropriately in that regard. We're going to be talking about trauma care. We're going to be talking about cancer issues. We're going to be talking about a lot of issues, kind of updating everybody on those. We've got some great panels coming in to talk about these issues. We also have members of Congress who are going to be part of this as well. We're going to hear from at least 5, and that number I think is going to be even higher than that, of members of Congress. What's their perspective? Kind of direct messages to the American College of Surgeons and our members. But then on Monday, Sunday is a great day, but Monday is really the key to the whole thing for me, because Monday is the day we go to the Hill, we go to the legislators and talk to the legislators about this. And we're going to do that virtually. And we're going to do that as if we're going to have the same types of meetings that we have with the members of Congress, with their staff. I want to make sure and hit this one point. And I say this every year at Advocacy Summit. When you're going into a meeting, the congressional staff, every member of Congress has a staff person who works on healthcare issues. Oftentimes your meeting is with that staff person. That's the essential meeting. The member of Congress, they're talking about 1,500 issues in the course of a day. If you're meeting with the congressional staff, that's the critical meeting. Because if you convince the congressional staff person, what they call the health legislative assistant, then you're 99% of the way there, because that member of Congress trusts that staff person. If you can't convince the staff, you're done. You have no chance of getting this done. Monday is the essential day as we bring these issues forward as to what we learned about on Sunday, and then bring them into action on Monday. And we'll be doing this as states within your districts, and everybody will be getting a schedule of Hill visits and the like. So it's really an exciting and probably one of the most important days that we have of the year.
Now there's some fellows of the college, some surgeons who might not be fellows, hopefully not, might not be, as well as some non-surgeon physicians who are elected and serve on the Hill. Are those visits any different?
Every congressional visit is a different type of visit, whether you're talking to somebody who's very experienced on healthcare issues, be it one of the surgeons or MDs who are in Congress, or a surgeon who sits on one of the healthcare committees. But I often say, when you go in and you're talking to somebody who's not as educated and doesn't have as deep of a background as others do on these issues, that's your opportunity, because you're the one who's going to guide them in the right direction. Sometimes the people who would think they're the smartest people in the room, they brush you off very quickly. I know. But when there's somebody who's new, who's kind of hungry for the issues, oftentimes these staffers are very young, they're incredibly smart. But if you can be the one to guide them and teach them, and shoot them an email afterwards that says, hey, I'm glad to help with anything. If you've got any questions, use me as a resource. All of a sudden, you've made a friend for life at that point, because they're just dying to have somebody to be, I got to trust something. I got to email Dr. Wexner because I liked him and he was nice and I can ask him a dumb question. Shoot that email. All of a sudden, you've got a friend in a congressional office that could be the best friend forever as far as helping you on some of these issues. So these are real opportunities going forward.
Well, those are great previews, and I'm sure anybody who's not yet signed up is going to after listening to you. And towards that end, maybe Dr. Turner, can you give us a little glimpse of one or two of the high points, or three of the high points of the meeting that could entice anybody who's remiss and hasn't yet signed up to do so?
Well, a couple things I'd highlight. First, I'd say that we are really cognizant of how busy everyone is. And as a result, we've shifted the meeting's footprint back a day. So for those who come to the meeting in the past, you'll remember that there were often lots of committee meetings on Saturday, and then there was the social event Saturday evening, and then Sunday all day was leadership programming. Monday all day was advocacy education, and then Tuesday were the Hill visits. We've shifted everything back, mindful of taking surgeons out of the operating room or away from their care of patients. So we've moved all the committee meetings off the footprint of the meeting. So if you're a governor, an advisory council member, or on one of the committees that used to meet at Leadership and Advocacy Summit, you now have some other date on your calendar. And the leadership programming will be Saturday. Again, mindful to your earlier point, Dr. Wexner, about Zoom fatigue. It's not an all-day thing like it used to be. We used to start with breakfast, and we would have several talks in the morning. We would have lunch all together doing our states breakouts, and then have more in the afternoon. We're keeping it to a fairly tight few-hour block. I will open it, Dr. Hoyt will close it. So that's familiar and something that we've done for quite a many years. And then some of those other talks that we've talked about, making sure that there's something for young people, making sure, one of my business school professors has agreed to be a faculty person to talk about teens and how to get the most out of our teens. Again, there is something for everyone, whether you are a leader in your practice, a leader in your hospital, a quality leader, or if you have an ACS role as a governor or regent or an advisory council member or an officer in a chapter, or if you're a leader in some other capacity that may bridge between healthcare and advocacy, or healthcare and industry. There really are actionable tools that everyone can take home. And then again, that segues very seamlessly into the advocacy and health policy programming on Sunday with Hill visits on Monday. So we really have been mindful about bringing everything into as tight a footprint as possible. The other thing that I'd share is that we will have ACS staff on hand on Saturday morning, because this is, again, an opportunity for any member to ask any questions that they need. So whether it's an education issue or a communications issue or a quality issue, we'll have staff that can field those questions in real time. So if you're interested even in becoming a member, so you're hearing about how amazing this is and you're a surgeon who's eligible, but you haven't signed up yet, we'll be able to take care of that as well. So that's another opportunity for engagement across the board.
Fantastic, wonderful opportunities. And I will miss the Saturday evening reception and the Sunday dinner and some other things, but it sounds like it's going to be another spectacular event, thanks to both of your vision and energy. Any parting comments before we close and show people how to register?
I would just encourage anybody who already is registered, and particularly those who have been to Advocacy and Leadership Summit in the past, to tell their colleagues, tell their friends, tell their residents. We need to make sure that we get as large of a group as we can to help deliver this important message. So be an ambassador for us. Help to sort of deliver that message. Invite your colleagues, encourage your friends, and talk about this in the Doctor's Lounge. It's really going to be an incredible meeting, and I really encourage everyone to attend.
Great advice.
I would echo that. I mean, this is the opportunity really where the rubber meets the road. There are lots of things that are great in surgery, and there's some things that aren't going the way that we want them to. So this is the opportunity for our voices to be heard, to exert influence on the process that shapes the way we're able to care for our patients. So, this is really an easy, in quotes, an easy opportunity to engage in the advocacy process. And there's really no reason. We will take you by the hand and lead you, tell you how to say it, what to say, give you, pointers and talking points, and make it very easy for you. Even if you've never done this before, this is a great chance to engage in our advocacy efforts, in our leadership efforts. And again, if you're not a member, join. I mean, I think the registration fee, because there's only a registration fee for non-members, could get you to be a member. And then you can avail yourself of all the great things that the ACS has to offer in terms of products and services and value. So we hope to see all of you in just a few short weeks.
Great advice. And I encourage everybody to participate, to spread the word, disseminate the word. It's tremendous fun. It's super highly educational. And it's very gratifying too, to know that you can make a difference in our present and our future and healthcare for our patients. So thanks both. Great seeing you both again.
Thanks so much.
Thanks very much.